atrial flutter. Hey everyone, and welcome back to Quick Medical Review. In this episode, we're talking about atrial flutter, a condition that every healthcare professional will encounter at some point in their career. It's often seen as a cousin to atrial fibrillation, but it has its own unique characteristics and challenges. By the end of this episode, you'll have a comprehensive understanding of how to recognize, diagnose, and manage atrial flutter with practical tips for real-world clinical practice. So if you've ever wondered, how can I spot atrial flutter on an ECG? Or when should I consider electrical cardioversion? Stay with us. Let's set the scene. Imagine this, you're on call, and a 77-year-old man presents with sudden palpitations and shortness of breath. The ECG shows a distinctive sawtooth pattern. You're thinking, is this atrial fibrillation? Is it supraventricular tachycardia? Well, what you're likely seeing is atrial flutter, one of the most easily recognizable arrhythmias, but also one of the trickiest to manage correctly. So, what exactly is atrial flutter? At its core, atrial flutter is a type of macro-reentrant tachycardia, meaning the electrical signals in the atria are essentially stuck in a continuous loop, causing the atria to beat at a rate of 250 to 320 beats per minute. This rapid rhythm gets transmitted to the ventricles, often in a 2-in-1 ratio, resulting in a ventricular rate of around 150 beats per minute. You might be wondering, why is this clinically significant? Well, the fast, inefficient pumping of the atria increases the risk of blood clots, stroke, and hemodynamic instability. Unlike atrial fibrillation, the electrical activity in atrial flutter is more organized but just as dangerous. Knowing how to spot it, and more importantly, how to manage it, is essential for patient safety. Alright, now that we've got a solid definition, let's talk about practical aspects. We'll break it down into 3 major parts. First, how to recognize atrial flutter on an ECG. Second, how to diagnose it and identify underlying causes. And third, how to treat it, including the critical difference between rate control and rhythm control. Recognizing atrial flutter on ECG. Look for the hallmark sign, the sawtooth pattern or F waves in leads 2, 3, and AVF. This pattern occurs because of rapid, repetitive atrial activity, and you'll often see a ventricular rate of 150 beats per minute due to a 2:1 AV block. But be aware, this pattern can fluctuate with the rhythm, sometimes converting to atrial fibrillation and back to flutter. Important tip: if you see a heart rate of around 150 beats per minute with no obvious P waves, think atrial flutter until proven otherwise. Diagnosing atrial flutter. History and physical exam are key. Patients may present with palpitations, dyspnea, lightheadedness, or even chest pain. Ask about triggers like recent cardiac surgery, valvular disease, or electrolyte disturbances. Your first investigation: a 12-lead ECG. It will confirm the sawtooth waves. If it's not clear, you might need to use a vagal maneuver like a carotid sinus massage, or give IV adenosine, which can temporarily slow AV nodal conduction to expose those flutter waves. Other tests to consider include echocardiography to assess for structural heart disease, thyroid function tests since hyperthyroidism can trigger atrial flutter, electrolyte panels to rule out metabolic disturbances. Now coming to treatment. The management of atrial flutter depends on whether the patient is hemodynamically stable or unstable. If unstable, example like signs of shock, myocardial ischemia, or acute pulmonary edema, the answer is simple: emergency electrical cardioversion with synchronized shocks. This is life-saving and should not be delayed. If the patient is stable, you have 2 options: rate control and rhythm control. For rate control, use beta blockers or calcium channel blockers to slow the ventricular rate. For rhythm control, consider electrical cardioversion to restore normal sinus rhythm. This is especially useful if flutter has been present for less than 48 hours. Here's a useful clinical pearl. Rate control alone is often ineffective in atrial flutter because it doesn't resolve the reentrant circuit. For long-term management, catheter ablation is highly effective with a 92% success rate. Alright, time for a quick clinical challenge. Imagine this scenario. You're in the emergency department and a 76-year-old man with a history of congestive heart failure presents with palpitations and shortness of breath. His ECG shows a ventricular rate of 150 beats per minute, but it's not clearly showing sawtooth waves. What's your next move? Here's a hint. You can try a simple bedside test to expose the flutter waves. Yes, a carotid sinus massage or vagal maneuver. It slows conduction through the AV node and may reveal the flutter waves. This is a great reminder of how small, simple interventions can have a big impact on patient care. I'd love to hear your thoughts. What would you do in this situation? Share your answers in the comments. How does all this knowledge apply to your clinical practice? Well, here's a quick checklist. First, recognize. If you see a heart rate of 150 beats per minute, always suspect atrial flutter. Second, confirm. Use an ECG and consider adenosine or vagal maneuvers if necessary. Third, treat. If unstable, use emergency cardioversion. If stable, decide on rate versus rhythm control. And don't forget, atrial flutter often has an underlying cause. Look for triggers like hypothyroidism, cardiac surgery, or metabolic disturbances and address these to prevent recurrence. To wrap up, we've explored the key features of atrial flutter from recognizing the sawtooth pattern on ECG to treating with cardioversion and ablation. If there's one thing to take away, it's this. A heart rate of 150 beats per minute should always make you think of atrial flutter. Remember, if you found this episode useful, share it with a colleague. Leave us a comment with your questions, and we'll answer them in a future episode. Be sure to subscribe to Quick Medical Review on your favorite podcast platform. And if you enjoyed today's episode, please leave a review. It really helps us reach more people like you. I'll see you in the next episode.